We're just going to start now, I think. Hopefully you've been friendly to your neighbor and haven't ignored them. My name is Janelle, and I'm one of the organizers for Evening Rounds. For those of you who don't know, well, I guess everyone should know what it is, but for some background for Evening Rounds, we're a monthly speaker series profiling healthcare professionals and digital technologies. Each month, we bring together health professionals, communicators, researchers, and students to share ideas and strategies designed to affect change in the healthcare system. So we started with healthcare and social media, and we've really branched out into just digital technologies and digital communications in general. So I'm just going to start it off with a few announcements, and then we'll do introductions. So we encourage you to live tweet. There is Wi-Fi in the room. Hooray. So it's under Evening Rounds. There's no password. We'll be live tweeting at Evening Rounds with the hashtag eRounds, as well as Healthcare Social Media Canada, HCSMCA. And then the handle for CDM is Center Digi Media. So you can just follow us, and if you want to use those handles, feel free to. We are also videotaping this session, so we videotape all of our sessions for professional development and just for fun. And they'll be on YouTube, so make sure to check back. We also have a Q&A at the end, so you can see it's a panel discussion, so people will be speaking, and then there's an interactive Q&A. So if you do want to participate, just make sure you press the button on your microphone. So I think most people know that by now, but it'll just light up red, and then just press it again to turn it off. And that's so the audio shows up in the video. I think that's it. So lastly, we just want to thank our good friends and presenting partners, Providence Healthcare, for letting us in this conference center. And I'm just going to bring up Justin Karasik to say a few words and introduce the speakers. Thanks.
Okay, good evening, everybody. I'm Justin Karasik. I can't say my last name. That's not a good sign. Too much Thanksgiving drinking last night. Anyways, I'm Justin Karasik, and I'm the Director of Communications and Public Affairs for Providence Healthcare. St. Paul's Hospital, the site that you're in, that's kind of our flagship hospital. And so thank you, everybody, for coming today. And I want to give you a little information about what tonight we're hoping to accomplish. So tonight's session is called Student Engagement in Healthcare, a Process for Partnering. So healthcare organizations face constant capacity challenges, and there's just not a lot of money in healthcare here in BC and across the country. And we need to get more done, innovate more with less resources. And what we are lucky enough to have here in BC is that there's students interested in digital communications, and they want experience in this realm. Work experience and working for an organization like Providence Healthcare, or maybe some of the organizations that you guys represent. It works for them, and it works for us, so it's a win-win situation. So today we'll learn how to engage students to join your organization as interns or as potential hires. The Center for Digital Media will share their process and talk about what students and health organizations can expect when a student joins an organization as part of their degree. So we're going to hear from Jeanette Kopak, and if I pronounce any names wrong, I apologize in advance. But Jeanette is the Associate Director of the Masters of Digital Media program, as well as the Director of Operations and Business Development at the Center for Digital Media. Jeanette is a digital media veteran with 16 years of experience at the CBC in roles that range from designing and implementing the corporation's first local newsroom editorial system, to facilitating and spearheading the original cbc.ca website, the Atlanta Olympics, so that was the first Canadian Olympic website, and the 1997 federal election, the first live election coverage website. However, the highlight of her CBC career was leading a multi-million-dollar, multi-year project to catalog, restore, digitize, and preserve the CBC radio and television archives across Canada. So excited to hear from her tonight. And before I bring her up here, also here today with her are some of her fabulous students, and I'm for sure going to get your names wrong, even though we just met, but I'll try again. Bettsina Walkinson, You can just wave. Bony Banerjee. Okay, close enough. And she was involved in the Hacking Health Project. John O'Keen and Andres Fajardo. And he was involved in the Aware app project. So welcome everybody. And Jeanette, maybe I'll call you on to get the show started.
Thank you. I'm pretty excited about this because I've been doing digital media for a long, long time, and I joined the Center for Digital Media as a project manager 7 years ago, and I landed up staying because I love the students so much, and I'm very proud of some of the work that they've done specifically in healthcare. So we are the Masters of Digital Media. This is our bizarre-looking building. It looks like we call it the Sandcrawler. It's brand new. It opened a year ago. These were the first students who actually came into it, and they all lived there actually last year. The program itself there's only one program in that entire building, and it's a graduate program, a master's degree program. And when the students graduate, they graduate from SFU, UBC, Emily Carr, and BCIT, which is quite crazy because that means anytime you change the curriculum, it has to go through 4 universities. It also means that the standards are very high. So our quality of our students are very, very high. It also means that the curriculum itself has got a little bit of everything in it. It's got art, it's got science, it's got bits and pieces of... So the students, I'm going to go through this fast because I want you to hear from the students. The students are multidisciplinary, which is one of the reasons why the program was actually created in 2007, was because the silo nature of universities. There's a faculty of arts, there's a faculty of computer science, there's engineering, and they're all very siloed, and there's no place where all of these disciplines meet. So we were created to allow computer scientists to work with art historians, to work with engineers, to work with scientists, to work with business people, financial analysts. So it's a mishmash of skills that work together. The other very cool thing about the program is it's very international. There's one Canadian on that panel, that's John. But we're about 65% international from all over the world, from Colombia, Mexico, India, China, Singapore, you name it, and we've got students from it, which is very, very cool. And of course, we have Canadians. And last year, we only had 2 people from the Lower Mainland. Everybody else was from someplace else in Canada. So you get a great viewpoint. So I'm just going to talk a bit about what the program does and sort of the focus of the program. It's a 1-year program with 3 consecutive terms. The first term is what we call our boot camp term, where they actually work really hard. It's 15 credits, which is a lot for a graduate program just in 1 term. They produced a bunch of projects. They take improv. They learn how to solve people's problems, and they learn a bit about the business. But 65% of the program is actually project-based. So their second term, which is coming up in January, they actually work on projects for outside clients, real outside clients, people who actually, they actually have to satisfy their needs, which is very, very unusual. They're not working on their stuff. They're not working on faculty stuff. They're actually working on projects for other people. It's pretty scary, and it's a pretty intense experience to go through that. They do take that first project, the January project, is 12 credits, which is a lot. That's the equivalent of a master's thesis at UBC. And the success is how happy the client is, or what problem you've been able to solve. They take 1 game design course and 1 elective, but most of it is these projects. In the May to August term, they do another project where they can elect to work again for an outside client, which some of them do because they want that experience of actually getting to know how to solve somebody's problem. Or else they work on a pitch project where they actually they sell us on an idea, and both these, actually everybody on this team has actually pitched us on an idea, and they want to turn it into a company. So they could do either one. The program itself is incredibly experiential. Nobody sits at the front of the class and talks to you very much. You build things, you work in teams, you collaborate. Collaboration is a huge piece of what we teach, how to solve problems in dysfunctional teams. That never happens. That never happens, does it? You can see the first day, and you guys can attest to this, we do a mosh pit. I actually think it's a symbol of the program because they have to carry each other over their heads, which requires an enormous amount of trust. It requires support. It actually becomes a symbol of what happens to them in the program. And the look on their face is, oh my God, the first day they see that what they do on their first day, they're going, this is grad school? They also do a lot of rapid prototyping and building. We teach speed, we teach agile project management, which is iteration and building fast. And in the old method that I grew up in is and you guys probably know this, you gather requirements, you have meetings, you talk about it, and then you build something that doesn't work, or that it works for the finance department. What we teach is you build something, you test it, you iterate, you build it, you test it, you iterate. And that in digital media, you have to do that because A, the technology is changing so fast. And the second thing is you have to meet the client's needs. So you can't sit in a room and gather requirements, make big requirements documents, and then 12 weeks later give them something they don't want. You constantly have to have the clients involved. So we've done, in the project section of the course, we have done 3 major projects with the Arthritis Research Center, the Mary Pack Center specifically. The one that we actually get the most press for, and we've gotten for some reason, we've had politicians talk about this project. This was a project that I thought was going to be really simple and ended up taking 8 months and 3 internships later. But it was actually designed to help patients who have just been diagnosed with rheumatoid arthritis to decide their healthcare treatment, whether or not that they should take methotrexate specifically. So it's called the Answer Tool, and I'm not doing live links, but you've got links to all these. The Answer Tool is a really interesting experiment for us because it's got 6 videos in it, and it comes out with a questionnaire, and you can then go back to your doctor and say, these are all the issues that I have with methotrexate. They're now rolling it out to other drugs as well. We now have Answer Tool 2. But Linda Lee, who's actually been she's at the Mary Pack Center, but she's also teaches physiotherapy at UBC. She's been very, very active in basically collaborating with us on grant applications. Answer, when we sat down and talked about it, we thought, we could crank this out in 4 months, no problem. But then we brought in the actual, they call themselves consumers, people who have rheumatoid arthritis. And that totally changed the way we started to approach it. So we actually we had an expert who had rheumatoid arthritis sit in all the shoots and actually say, well, no, that's not how you act when you do it. So we had this real reality check. We've been so successful with the Answer Tool and working with CHR for grant applications that they actually quoted this project as one that exemplifies a good use of technology for knowledge transfer. And they have a whole section in how to apply for grants where they talk about knowledge transfer, and they actually quote this specific tool. And the thing that was really cool is students were working with practitioners and working with actual people with rheumatoid arthritis. The other project we did with the Arthritis Research Center, which is also quite successful, is basically called Making It Work. And it was slightly different, but again, working with clients, in that Dr. Laquelle is a rheumatologist, and she was working, it's her passion to get people with arthritis working again. So she had developed this massive Bible, it was like this big, that it was a workbook for people to go through to try to get them back to work. So it was not working. It was a big manual. So she came to us, and we actually did an e-learning tool with her with a product called Articulate. And these guys, all of who actually are now working for game company. Actually, the interesting thing about that team that worked on this, they're all working for game companies. But they used that interactivity and that game knowledge to make this manual really, really interesting for the patients who are doing it. Again, that one was an 8-month project with interns on bookending out on either side, and they're still in production, and they're now doing clinical trials on this one. So the last project we did, which actually we've done a couple of other smaller ones that our website will show you, but this is an interesting one. The Men's Health Initiative BC came to us and wanted to do a game to get men 24 to 35 interested in their health. And it just so happened we put together a team with one woman of men 24 to 35 who were not interested in their health, but kind of interested in their health. So they actually worked with the people from the Men's Health Initiative and said a game is not going to cut it, because they're sophisticated gamers at that age. You can't spend enough money to make it sophisticated enough. But what they are at that age is basically irreverent, and they really think a lot about sex. So they totally changed the entire campaign to actually become centered about men thinking about sex. And the head of the Men's Health Initiative really didn't like. He was like 55-ish, not really keen on it. It was really quite raunchy for him, but for the demographic, it worked really well. These guys who did this project for the first term, they pitched us actually to do it for the second term for their own project, because they got so involved in the possibility of social media and branding to actually change the way the messaging was going out in men's health, that they actually landed up working on it for 4 more months, created even more videos, and landed up actually showing the videos at the final game of the Canucks. I'm dating myself, I think 2 years ago. When were the riots? The year of the riots.
Correlation only.
But they showed Stan Smeel. They got Stan Smeel as a spokesperson and showing the video, so that was pretty cool. But they actually came up with a whole branding scheme and a whole social media scheme. And when the project was over, they actually hired one of the students to continue it on and keep the branding going. They actually created a YouTube channel. But again, this was something that the students did. They sat down with them for quite a long time and said, this is what you really want. You want people to remember this. They don't want people to be preached at. And they actually, one of the things he did, I call it algorifying the PowerPoint. They took the PowerPoints that the Men's Health Initiative was doing and totally changed them and made them much more appealing to the demographic that they were going to talk to. So the pitch projects, which is what the Men's Health Initiative one turned into, where they actually turned it into doing it for a client, is what they can do in their final project. We did another project called Wound Care, which actually is an American, there was an American student who got some money from the US and actually created, using game technology, a game engine called Unity, and 3D imaging and 3D, to actually how to manage extended care facilities, how to get first-line people who actually have to turn patients and manage bed sores and wounds, to teach them how to do it properly, specifically for an American audience, because the problem down there is, well, they have a very different Sioux mentality, and there were tons and tons of lawsuits happening. So they landed up moving. This actually company is now working out of San Francisco. And finally, we have an AWARE team, these guys will talk about, that is actually developed. They're in the early stages of developing a mobile app to help asthmatics deal with basically planning routes to manage their own manage their routes through a city with pollution and pollutants. And this is a really high-level discussion. We'll get into more detail level, and you can ask lots of questions, but I just wanted to give you. So I mentioned internships. The students actually go on interns. These guys are all on internships actually right now, but they're building their companies in internships. The internships are from September to December, and then they can actually do a second internship if they want, from January to April. A lot of people want to have 8-month internships to get that extended experience. We also do workshops for both the Men's Health Initiative and the Arthritis Research Center. We did some preliminary workshops with them before we did projects with them to try to get out of them what the issues that they were trying to solve. We also hosted, and we're going to host this year, we hope, the Health Hackathon. And Bonnie and Betts are going to talk about what they did for the hackathon. So our building, even though it's a brand new building and quite spiffy, our old building, which is still part of the Center for Digital Media, has what we call the hangar, which is a 5,000 square foot big vault that used to be a tractor factory. And we bring 300 people in there, and for 3 days, we give them a problem to solve, and they create apps or games. And health hackathons, they're happening all over Canada, have become really good ways to get people like these guys working with health professionals to solve problems. The other thing you can do is hire students, which they also do. People also hire them either as interns or part-time. The other thing that I have helped with in the past is helping people when they're doing their grant applications for building whatever it is that they're trying to test or whatever it is they want to do, is I oftentimes, or if the school will oftentimes partner with them and say, this is how much it was going to cost you to hire an intern to build it. And this is what we think it's going to work. And we're very well known by the tri-councils for and so they like to see digital media in applications. I don't know why, but they do. So, the students, over to you. Hacking health first. Okay, Bonnie.
Thank you, Jeanette. So I will be sitting and giving this presentation for a change, just for experience. Hi, I'm Bonnie. Well, actually Nabamalika Banerjee, but it is scary, so just Bonnie is good. My background is computer science engineering, and I'm from India, and I came here last September to join the Masters of Digital Media program to explore, extend my skills as a developer and a designer, and to, learn all that from new projects and from events, all the jamming that happens, one of them which is the Hacking Health event. So Hacking Health is, for those of you who don't know, is just an event where we get together people from a variety of backgrounds. For example, specifically for Hacking Health, it is the healthcare industry. You have designers, developers, artists, social media persons, doctors, practitioners, everyone in one big room, and they're just ideas thrown across. So I participated in that event, which was 24 hours long, and there was a doctor that pitched his idea about having a mobile application that would actually give you access to all your personal health record systems. So one of the big problems that he was trying to solve is that information, your personal health information, is supposed to be closest to you. It is your most important information. But currently, it's been scattered around in file systems, in computer systems. It's not in one place. You don't have one place to access all of that information. So we wanted to bring that information closer to people. And we developed this idea called MeKeeper. So MeKeeper is this mobile application that brings your personal health information, your medical information, like your medical history, your allergies, your vaccinations, your immunizations, everything in one place. Now, we had 24 hours, and it was a big idea. So one of the things that we had to do, something that I feel I also brought into the team, was scoping and how to transform that spark of an inspiration, which is high energy and this big thing and want to change the world, to something that we can build and prove that it works in 24 hours. It sounds crazy, but we did it. So for the first thing, as you see, we were a very big team. So we had developers, we had health practitioners, we had designers, everyone come together randomly for the first time in life who believed in this idea. And that's how it works. So we all came together, and what we did was we tried to branch out and segment the time that we have, the little time that we have, as you can see. So we moved from what we learn in our school called Agile. So we have an idea, we brainstorm, we try to think about, what are the features, what can we do about this? And then we actually discover, so we talk about the customers, we talk about the users, and then we actually design it, and then we prototype, and then it goes all over again and iterating on it. So one of the big things that I contributed was in the design team, where I brought in the human-centric design that we call. So in MeKeeper, because it's for the users, it is for anyone and everyone here. The more important thing is that person has to understand that information. He has to be able to put that information. It is for the user. So we brought the human-centric design ideology in place to have personas, to understand the needs of the user, to understand the needs of the people, to create this application. I was also there to create the logo. So after a few iterations, we came up with a logo, and I did the branding. So in the end, in 24 hours, we did a lot of stuff, and my role, most of it was in the design side, as well as a little bit of development, and also, graphic design. So we did the interaction designs, we wireframed it, and we actually ended up building something in the end of to 24 hours. And it's it was a good news because we actually won an award for the People's Choice Award by the end of the event, which was really cool. So I'm going to talk a little bit about the process that we actually went through to make you maybe familiarize with how we take that spark into something that is tangible. So I brought in a lot of stuff that I learned from CDM in the few months that I was there. For example, the first thing, everyone has different perspectives when we are in a team of 10 people with different backgrounds, like health practitioners saying something, developers saying, no, that's not going to happen, designers saying, doesn't look beautiful. So there was a lot of crazy ideas, but the point was to collaborate and come up with a solution for users. So we came up with what we call, we use certain tools that we learned in CDM, like Bullseye, something very simple. You come up with features that application would have, and then you go to the core because you don't have time to build everything. So you build what is required and what you think the person will use the most. Apart from that, then we moved on to creating the requirements, and then we iterated, and then we have lots of arguments, but we all came down to something that we all believed in was the core of what the information that was important to the user. We ended up, I also created the wireframes with the design team. So what would the application look like? So we passed on these screens that you can see was very rough. It was just a whiteboard and some stickies and some markers, but that's how it works best. So we did that, and we actually developed the application, which is not here right now with me. But the great news is that it was just this small spark of an event that led to this team actually following up after the event, and they are incorporating soon, and the product will be launched because all of them believed in the idea with some of the team members. So have a look out for MeKeeper soon. It should be launched, hopefully to help the community. So if you have any questions, please feel free to talk. Thank you.
Okay, so I joined a group of 2 programmers. One of them pitched an idea for a mobile application that for patients that had with the ostomy post system. So this application facilitates and makes easier the recovery process. So the application is for users to post in a daily basis their symptoms, and it has you can take pictures of your wound. You can answer some questions such as how many times did you empty the pouch? Do you have abdominal pain? Do you feel happy? Do you feel unhappy? And then this information is sent to a digital platform in the hospital, and it can only be accessed by the nurses or the doctors of the patients. And they are updated on a daily basis on the symptoms of the patients. And then if there are any complications, they immediately alert the patient, either by the mobile application, send them a message, or either talking through them on the phone. So, and then at the end, that would reduce the readmission cost after surgery when patients have to go back after surgery. So my role, I joined the team pretty much doing user interface design, and I assist in the user experience design as well. And I also work on motion graphics. So basically, I collaborate really close with the programmers to understand what were the specifications for a particular user, right? So because of a very specific patient, so I had to understand the language that they were talking about using the right words in the interface, right, for the patient, and also understanding the programming side of it. I mean, coming from a creative background, I'm very visual, not so much into programming. So it was a really, really nice experience, and so I'm going to show you a video that showcases a user story of the patient and how the application facilitates the recovery and makes their life easier. So it was made in 3 hours, so don't expect something very much polished. So that video was presented at the end, and along with a prototype. The next slide is a wireframe of while working with the programmers, you're doing some UI. So it was for me very important to communicate well with them so that I can come up with something good and intuitive that feels intuitive for the patient. Because we also have to think always into what is going to be the patient, right? Like pretty much what are the first thing they have to see, what kind of colors you have to see so that it's not visually busy. It's something that it feels nice and happy to go every single day, every morning to put some of your symptoms there. So then the next slide is a mock-up of the prototype that we did. So then we were talking about deciding what kind of questions we're going to ask there, what is going to be first, how they're going to interact with the application. This is another wireframe of the dashboard of the application. So for us, it was very important to make it very personal, so that you enter as a patient, you have your own profile, it's private, you answer questions like, oh, are you feeling happy today? Oh, yes, I feel like. You select like a mood for you, and then you personalize your application, and then you feel happy because that information is going to be sent, and they're going to be keeping you updated with your recovery, right? So the next slide is the dashboard, the prototype of the dashboard. And I have in my phone here the prototype that we presented in the Hacking Health. We won the second place for the best application. And this is just a prototype. And if you guys, anyone has any question, feel free to come and check it out in here. It's simple, but it's a good prototype. So thank you so much.
Okay, good evening. Thank you very much for coming. I'm really happy to be here and to be able to share a little bit of our experience in the development of this project. It's also really interesting to know that these type of environments exist to collaborate and work together with people from different disciplines and different sectors or industries and create things together. My name is Andres Fajardo. I'm a computer scientist, and before joining the Center for Digital Media, I was working for the healthcare industry and for the financial industry in software engineering. And this is John Kim. He was also enrolled in the financial industry as an analyst and as a, what was your other?
Troublemaker.
Troublemaker. And
generally good for nothing.
Yes, as Jeanette put it, and as other people have been presenting today, what is really interesting about the process we follow at the CDM is this collaborative environment where people with different disciplines work together for real projects, for real people, and with real users, right? And this project I'm going to show today is in its early stages, that so far we have some results that we want to share with you. Basically, these are the topics I'm going to follow for tonight. I'm going to start with a brief introduction of the technologies and the community that is around the work that we are doing. Then I'm going to jump into some of the research and development process we went through. Afterwards, I'm going to present some of the developments that we have so far. And I'm going to finish, we're going to finish for this whole presentation with a session for questions and answers. Basically, as we know, sensor technologies are dropping in cost. And you guys maybe have seen all these new wristbands, new sensor devices you can find in your cars and in many other applications that we are using every day. And what is more interesting about these sensor technologies and the low prices you can get these technologies for is that there is also a community of people working individually on their own, creating new technologies and creating new sensors. And this is an example of one campaign that was launched in Kickstart last year, in February or March last year. And they were looking to raise $39,000, and finally they got $144,000. So this is an example of how communities can get together and can work with technologies that have an important impact in our daily lives. Their statement was a community-led air quality sensing network that gives people a way to participate in conversation about air quality. And basically, we at the Center for Digital Media, where we are very interested in working with communities and working with companies and developing things together, as we have been seeing during this presentation. So early this year, we got one of these sensors, specifically the sensor that this group of engineers developed in New York. And our first question was like, okay, what can we do with this? How we can participate in this process, and how can we give back to the community using these technologies that are becoming cheaper and cheaper and can be useful for our daily lives. So first objective for the first part of the project was to validate the reliability of these sensors. Specifically, are these sensors good at what they do? Can they actually capture information about pollution, about the quality of the air in a reliable manner? Can they be connected easily to other sources of information, to the internet, for example? Second approach for this first stage of the project we just finished was to understand current approaches out there in the community, how people are, and companies and the government, how they are communicating and how they are presenting information about pollution, about air quality in general. And the third objective of this first stage was to propose a service that can be leveraged using these low-cost technologies. So we basically got the device and we start exploring what we can do with it, right? And taking into account that it's a cheap technology and that people and final users like us can get them easily and buy them online. So answering the first question of the first objective, we wanted to compare the accuracy of these sensors. So we did a couple of tests with UBC. UBC has an air pollution lab, and we did other tests on our own. And this is an example of one of the tests that we run. This is a comparison of the pollution measured by a government sensor in comparison to this cheap, low-cost air quality sensor. Just a little bit of background, the cost of a government sensor is around $5,000 to $10,000, right? Whereas these low-cost quality sensors are around $100, $150, right? So this is an example of one of the tests we did. It was for a whole day. I actually was seated in that cafe that the picture is there for the whole day, and I could suffer on myself the consequences of pollution, because when you are for a whole day there, you can notice at the very end of the day how it feels. I was not expecting that, but actually that happened. So basically, as we can see, the standard deviation is extremely low and the measures are really, really accurate. So for us, it was a really, really good signal that we could continue going on. And we also compared measures on CO2. We also compared measures on the other pollutants that these sensors are currently getting. Another part of the objectives, as I was saying before, was to understand the way in which governments, companies, institutions are talking and are presenting information in regards to air pollution. So we did a little bit of research. Our team we were four in our team, so we sort of scattered our tasks. But basically, we found that there are around 80 applications out there in Apple Store and a similar number in Google Play that present information about air quality. There are also government websites, as maybe you guys have seen, and there are also other networks of like, for example, the Weather Channel that are aggregating data about the pollution in the surroundings. Something that is very interesting is that all the data is coming right now from government sources, so we didn't find a specific approach towards community data that is being captured from the community, like the case of these sensors that I was showing before. And also we found that the information is not unified. So as we know, the American government has its own standard for equality. Canadians, we have another one. China has another one. And each country has its own standard. So if you are going to another country, you will have to find the source of information and to understand or make your mind around the understanding of the specific air quality index that they are presenting. We also found that there's not an unified way of presenting this type of information. So the government, Canadian government, proposes a set of colors and a set of variables to present this information, whereas other governments present it in another way. The screenshot I have here is one of the applications that is one of the most famous ones on air quality. And as we can see, the visuals are not that intuitive for a final user, what 15 means. So it's also important, and it's also part of how we work in the program, is making sure that we are not also working with information, but we can actually present that information in a way that final users can interact in a meaningful manner. So that was also another important objective for the development of this first stage of the project. Now, having all these validations that we did in the early stage, we came up with this thesis that we are still working on. And this is, right now we are like in the second stage of the process, in which we are looking for the medical approach that we can take from these validations or early validation that we did. And basically, we want to create an application that could help asthmatics and people who have cardiac and some other respiratory illnesses to better understand what is going on in their environment. We understand that almost 30%, that's more or less what research has been showing us, that 30% of people who are suffering respiratory or cardiac illnesses are suffering those illnesses because of the pollution in their environment. And actually something that is very interesting as well is that most of the pollution comes from indoors, from the conditions of the air indoors. Actually, that depends, because if you are in a highly polluted city, like in China, for example, the things, in cities in China, the thing is going to be different, right? But as for the studies here in Canada, what the lung centers are reporting is that the pollutions indoor are the ones that are affecting the people in the most way. So this is a little bit what we are up to right now. We are exploring ways in which we can engage the community, engage institutions who are willing to support the development of these technologies, and that we can engage them in the process. Also part of this first stage that I was talking before was to validate the medical approach that we are pursuing with this thesis that I just presented, as well as the technical availability of the process. So we work together with the Lung Center, which is in the Vancouver General Hospital, and with Pacific Lung Health Center, which is also here in this building. And with 3 scientists in these institutions, we have been in constant contact and validating this thesis, exploring how these respiratory and cardiac illnesses are being treated, and how we can use these technologies in order to help them in the management of these illnesses. As part of the technical validation, we're working with a lab in UBC, which is called the Magic Lab, and they are developing the platform in which we are currently putting all the information that we are getting from these sources. Part of the technical validation that we wanted to do as a way to show that this approach is possible was to create a mobile dashboard. So we basically created a tool that it's web mobile enabled, and it picks up your current location using the GPS of your phone, and it starts aggregating data from the different air pollution sources that we have in the region in BC. So if I'm here in this building and I open the application, it's going to pick up the sensor that is in Robson Square, which is a government sensor. But if I'm at home and I have a sensor at home, it's going to pick up the sensor that I have at home. So this initial prototype, which is a functional prototype, is going to be up in a couple of weeks. It's a really, really interesting approach towards the aggregation of government-generated data and citizen-generated data in regards to air pollution. So it's the way in which we were showing that this approach was possible and meaningful for the context of someone who's suffering from some respiratory or cardiac illnesses, or is sensitive for that. Another important approach for this dashboard that we developed was unified visual reference. So It's not that clear here, but this is a little bit of the visual that we created. We worked with, in our team, there were some designers, and they engaged the process of searching how others are doing it and how we can present a meaningful and appealing way, visual reference of the quality of the air in a specific moment. Another interesting feature is historic analysis. So as you can see here, we are analyzing the data based on the trends, and we are providing a really, really brief overview of how the air looks right now based on historic analysis and how it looks in different other times of the day. And finally, an interesting feature is the social functionality, so people can share this and they can rate the air. So this is more or less you working as a sensor and saying, hey, I feel that the air here in this room is not good. And we start aggregating that data in order to create a community and a conversation around the quality of the air. I'm just going to put a video quickly that shows the vision looking forward, which is what we are doing right now. And then I will pass to John, who's going to present the conclusion.
I think asthma is like breathing through a straw. It's very narrow. You're always short of breath. My parents were very protective of me, and as a result, they prohibited me from playing a lot of sports. Having information, access to information at your fingertips is something that would definitely have been beneficial in monitoring your condition.
The AWARE project helps to provide information on air quality for those who are sensitive to environmental air pollutants. The application's core functions are to provide notification warnings, navigation, and location-based analysis of pollutant levels in your surroundings. Our mobile app will serve as a showcase to bring environmentally aware users together in one place to create dialogue and enable decision-making surrounding the greater issue of pollution.
So I love that video. I don't know about you guys, but I really get a kick out of it every time I get to see it. One of the most enjoyable parts for me working on this project was getting to work with doctors who provide some insight into the human aspect to these issues. This project started us literally playing with a sensor, right? And out of that emerged this kind of greater story and this greater narrative of how does it could potentially this technology help people, and getting to work with people like Bettsina who have a way of translating the technical challenging aspects of how does technology work for someone into something nice and simple and visual. Betts wasn't the person who worked with us on this project, but it was a lot of fun. And we're interested in going forward and collaborating with anyone and chatting and talking. If you've got small project ideas and stuff that you want to gauge, that's, I think, what we do at the center. So yeah, in conclusion, we'll cut it up at that. Cheers. Thanks so much for listening to us today.
Right on time.
So we anticipated people would have really specific questions about just how do you get in touch with students? What can students bring to what projects you're involved in? What new things could they suggest if you're trying to solve a complicated problem? So we're very, very much hoping that the people here have their questions ready.
I guess my question, I don't know who can answer this, but we're health professionals, communications professionals sitting in a office with 10 project ideas. What do we do? How do we get in touch with you guys, and how does it work?
The first thing you do is call us or send us an email, which of course I didn't bring any business. Oh, I might have business cards. You either call me or Dennis. Dennis Chenard is our Director of Industry Relations. And then we ask you to come down if you can, and we're pretty flexible about time. And just talk to us about what we can do and what potential there is. The school's we've only graduated 6 classes, so we're learning every year. We iterate every year. And we've learned fast. We know that healthcare professionals especially actually are probably the most strapped for time. And so we tend to give you suggestions on how we can work together that fit what you need to be. But oftentimes it's just calling us and just telling us what your problem is, and then we point you to the right direction, or we get you involved somehow.
I have a follow-up question to that. What is the ideal person and or project when we approach you? When you say that's the kind of person or that's the kind of group we want to work with. And I presume some of it has to do with some open-mindedness to the ideas of the students.
There is no perfect anything. I think from a project point of view is we look for a good match of what we can do, because all of the projects we have done that have been successful have come with massive, huge ideas, and then we scope them down, and then we build on that. So we say, okay, this is what we can do in this much time. I often will ask them if I often suggest I hire an intern who will then work with them to define what it is they want to build, because they have an app, especially because the app world. The big piece of trivia about the school is we opened the day the iPhone came out. And the students actually drove, they weren't available in Canada, the students actually drove to Bellingham to get them. And they cracked them because they know how to do that stuff. I don't know what that means, but anyway, they basically had iPhones before they were allowed it, before Rogers had them. But the interesting thing is the students will have more ideas than any of us can possibly come up with. So just give us the problem, but I often say just hire a student as an intern to get you focused and to tell you what's possible, and also say whether or not it's a dumb idea. I mean, they won't tell you that, but they'll sort of walk you through the process. The problem with apps in general is there's a million apps out there, and a lot of them are really bad. And so what we teach is that whole concept of focusing in on what problem you're trying to solve. That's what I suggest. But for the Men's Health Initiative, as an example, that one went in a completely different direction than we thought it was going to go, because the students worked with them quite a lot and said, well, you know what, this isn't going to work, and they came up with a completely different idea, which actually had to be sold. They kind of had to get a bit of buy-in, because the idea that they're going to build a World of Warcraft to teach about men's health was just not realistic. But that was the original idea. So I think the idea is to work with the students, because the interesting thing is they also the international piece of the program is really it at first when you think, well, so what if they're international? But they come with this whole different experience that they bring in to design and thinking that is very, very cool. So hand the problem to a student, and then they network out to all of their buddies. And I mean, I love the fact that they actually can get ideas from people back home. And the health I find one of the reasons why healthcare for me has been really interesting is the way that we look at healthcare in Canada is very different than the way they look at it in the US, and very different than the way they look at it in China. And so there's a very interesting dynamic of ideas that happens.
Speaking of community, let's hear from everyone. I'd like to just hear your thoughts and what it kind of felt like to interact with healthcare professionals. So it's one thing to kind of be with your kind of crew, with your artists and your programmers and whatever, and then all of a sudden you have a healthcare professional showing up saying not only do they have a problem, they also might have some parameters or some things that they've already tried. So if we could I just want to hear from everybody. And the mics will pick each other up if you just leave them where they are.
So I guess, again, back to what was interesting about our project was that we started off with something in a lab and then brought it to the healthcare professionals. And, we wound up working with 2 of the lung centers in town. So we went to them with kind of like a proposition, like, what do you think of this technology, and can it kind of help solve problems for a lot of the people who come into your clinics on a daily basis? It was really interesting getting their feedback, because you could kind of see people's eyes light up and kind of a sense of excitement about, hey, we've worked with these $5,000 sensors, and we've tried to do research studies to really kind of get a grip and a good understanding of exactly how air pollutants affect asthmatics. But, the solution that you guys are potentially offering at an incredibly low cost would enable us to get our hands on research data that would be incredibly valuable to us. So it's that process of discovery that's a lot of fun, but one of the big challenges I think we encountered is we're not healthcare professionals. Like, quite literally, we do something completely different on very small or different teams with different skill sets. So in order to get that kind of user understanding, it takes kind of collaborative weekly sessions. I think we met every week or 2 weeks with, one lung center, and just to get kind of not even a deep, I'd say more of a superficial understanding of our users was kind of only achieved over 3 or 4 months. But again, it's these small projects that can have like a larger impact, and they're definitely doable to get to kind of a proof of concept over a 4-month period. So, from my standpoint, working with healthcare professionals was amazing, because it opened up again, you'd never believe you could kind of engage this type of process and make it happen in a relatively short period of time. But yeah, it was really, really, really phenomenal part of my experience at CDM. I'll pass it on to Andres.
Thank you, John. Well, I would say that, at least in my experience, I think what I have learned is to think in perspective. Whenever we meet with doctors, with medical doctors who are in the daily lives of their research or their clinical undertakings, they put things in perspective and they think about the patient, right? We can be a little bit over-focused a little bit on the technology side or on the interactive side, but I think they teach us, or I have learned how to put things in perspective. I was meeting with one of the doctors who's doing indoor air pollution research at SFU last week, and the first thing that comes to his mind is like, I need these sensors to be able to continue with my research in countries where there are no resources, there is no energy, there's no internet, and we cannot bring our $5,000 sensors there. And if you guys can help us in, developing the digital media side of it, we are gonna be able to do a lot of research. So that long-term perspective of how you can give back to the community using technologies and approaching the problems, I think for me it has been the most valuable lesson through the process.
Well, in my experience, I always feel very excited about working or do something for the healthcare environment or area, because both of my parents are doctors, so I feel very much engaged and very much that I'm doing something good, and doing something for the community, as you were saying, is something that makes you feel really nice. And it's so interesting how you feel. It's like an artist working with a programmer, right? Like you work with someone from a completely different perspective, and it completely opens your mind. And it's something very engaging to learn from someone that thinks completely different from you, right? So I think it's very important also to understand that language, right? Which is a completely different language with healthcare professionals talk and we talk, right? So it's very interesting and very empowering to do something for the healthcare, for sure.
In my little experience in the hacking health, it was actually extremely a very good learning experience for me, because not only were the perspectives all different, but also one thing that is really cool is that how observant they can be about details that we probably don't notice. And the best part of it is that they have all the information, they have all the stories. You just need the right kind of people, or maybe people like us who just needs to extract those stories and find a pattern in them. And that's the only thing that's probably missing, because they have so much information and so much to offer. And that's what that actually takes a lot of time to understand the core, because even knowing the details might be a little, might go on the bad side, because people can get hung up on details and finding that, all those small things that matter, which might not matter when you're building something that, in my opinion, which is in a small time. So it's to understand and prioritize and filter that information, that this huge amount of information that is available to you. It was amazing.
How did you actually do that at the hackathon? Like, was everybody just there for 24 hours the whole time?
We went to sleep at, I don't know, we lived close by, and some of them actually stayed back, some of them went back. So my team was really big. So we had at least 2-3 health practitioners and doctors, and we had developers and designers. So one of the times when we really needed to focus was when we were trying to understand what the feature list is going to be. Okay. So the health practitioners came in saying that, which was very important, that they had all these stories that we had no idea, because it's their experience we get from. So, and we listened to all these stories, and we try to find a pattern, or try to identify the need. So when we get back on that was a really great experience. I just kept rolling. But the problem happened is when it started getting into the nitty-gritty details, and it's just a rabbit hole. And to be honest, it's not just health practitioners; it's everyone, and it's just very difficult to understand where you need to stop and move on. And if we wouldn't have this experience, at least for me in CDM, it would be very hard to identify those times to say that this is not important actually, and just go to the core and build
Is that
it.
ringing true for anybody? Anybody? Yeah.
I have a
Do we have
question.
you have a
Sorry,
question?
yeah. In regards of from what level do you take requests? Does it have to be upper management from the organization? Can it be really more or less a nurse that has their own improvement project on a ward that she wants to go forward and wants to make more of it? For example, patient education for a specific thing. Is there any scope in the project overall?
No. And I'll tell you, the answer tool, the arthritis answer tool, how that started was actually a research assistant at the Mary Pack Center was riding his bike by the Center for Digital Media, and his passion is to give patients tools, to empower patients to make decisions about drugs, about their own healthcare. And so he stopped and came in and asked what the place was. And then he just came in and said, so what do you think we could do? And it kind of went from there. But I also highly recommend the Hacking Health route for those kind of ideas, because there were people who pitched ideas at Hacking Health that got things at the end, like after 48 hours, that actually they could then go and get somebody to sponsor to build. Because that's what it's really good for, is getting stuff out, because it's in your head. It's hard to get it. So we don't care who it is. And to be honest, the senior management team, they tend to think this high. They don't actually think at the actual, and the one with there's one that we're working on now about helping arthritis. I don't know why arthritis is our thing, but we basically brainstormed with a nurse because a lot of people who are very heavy are waiting for knee replacements because of their arthritis, but if they actually got fit, they wouldn't actually need knee replacements. So there's a whole, we're working with a nurse whose idea this was, is how can I get people to understand that getting a knee replacement isn't the solution. It's just actually walking.
So was the program actually free that you built for the arthritis, or were there costs for the arthritis center? Because like the nurse who brought it up or the person who wrote
they
is probably
actually
not
hired,
the person who can make the decision of hiring someone.
The original discussion was free. The actual build is they actually got some funding to build it. So they hired students, they hired the interns to do it. We did the actual project for the cost, for cost. So whatever it cost us, we passed our costs through to them. So it's usually not a cost factor. It's usually more a time factor. Because the other piece, which they will tell you, is if you can't give the time to the project, it's not going to work either. And one of the reasons why I've been pushing more to try to engage with students at this level, at the Hacking Health level, or part-time, or is primarily your time. Because in order to do a project really, really well, what would you guys say about, you need to give your project about a day of a week with the client, right? Yeah, and that's really hard for people. And so that's what I learned from working with our early health. They just couldn't do it. I mean, you guys, when you met with the lung center, didn't we meet at 7 o'clock in the morning before they did their rounds?
Literally, their time was just so limited. I think probably if you said upper management.
So we're really aware of the time constraints. So it's worth the discussion and then coming up with creative solutions. Because the other thing about us, and I don't particularly know how this has evolved, is we tend to know everybody who's doing things. So we often can point people to work together. And the students often, they'll, like the Man Up project, the Men's Health Initiative, the second half, the students pitched us to do that. So you can pitch the students, I want them to do this project, and then some of them might grab onto it. But I find from my experience, the Hacking Health thing is the smartest thing that's ever happened to get these ideas up.
And Hacking Health is free, right?
Hacking Health
to
is
join
free.
the event.
Actually, and it's run, I think the next one's in February.
Hi. Oh, I see two questions. Can you
Okay,
wait
just
just
a quick question about Hacking Health. So if you have an idea at that event, or how do you choose which ideas are going to be taken on?
How did they choose? I missed that part.
Basically,
Went home.
It's in the initially, you just, anyone who has an idea gets the floor to pitch. So it just has, it's like a very small, like a 30-second, like you just need to tell what your idea is. and then you wait for people to grab onto that or to resonate, and then people just, they form groups and they try to, and they just connect. So like Betsy or me, like we had we didn't really pitch, but we were just there to understand and to see what the problems were we're trying to solve. And most of which people resonate is where they find where someone already has a solution, or someone's trying to already that, oh, I know this problem exists, or can resonate with a story. So it just happens very organically. There is, yeah.
Sometimes they know ahead of time. You can pitch it ahead of time, and people form teams. But what happens is, that's what happened to you guys. Someone would say, I want to do this, and then 3 people say, okay, I'll do that with you. And it literally is all sorts of people. It's just a very...
Yeah, in this one specifically, when you sign up for the event, they gave you the option to put a little bit of a brief of your project, and some people start arranging themselves before, like 1 week or 2 weeks before, and having discussions and even meetings before the event. So that was a really interesting thing.
When is the next event?
I think it's in February. I think it's in February. There's a website, Hacking Health, and actually there's a Twitter feed, Hacking Health. It's very, very successful in Toronto, Montreal. They've only had one here so far, but it's a really interesting way. Kendall Ho at UBC is one of the big pushers of it. It's a really good way to get people together in a room. We sponsor it specifically because the students love to work on it. And then it lands up being, we've landed up people who worked on Hacking Health landed up working on the projects afterwards, part-time. Like Sarah did it, a couple of other people there. And it was very cool. And it could be anything. There was a whole bunch of strange and wonderful.
It's just strangers in a room, and you just connect.
Yeah.
And yeah, that's it.
I want to hear from you, and then I want to make sure we get our other question.
I was just going to say that the really cool thing I noticed about Hacking Health was that rather than focusing on just creating your product, like the end solution, it's that you get kind of amazing groups of people that come together and solve the problems, so that you can get kind of like a blueprint of what it is that solves the problem you originally came in with, right? So, and it's like, just when I look at some of the projects and the way in which they've evolved, that kind of very collaborative group environment where all these different people are problem solving gives you a chance to kind of lay out something that can go on to become something so much more. And again, in 3 days, it's fantastic.
It's really good. Actually, there was a zombie game that came out of it that was pretty good.
Oh, the running game?
Yeah.
I like zombie games.
So you had a question?
I think you're interested in those.
Yeah. September to January. Or September.
The question is about the intern cycles. They're twice a year.
So how early then does someone have to put out an idea or request an intern?
Earlier is better, but because pretty well everybody's taken this year. We have a showcase in June. May? No, June. It's in June. We have a showcase in June, which if you want to get invited to, we'll invite you to. And you can meet the students and kind of wander and talk to them. And then a whole bunch of people got offered jobs like within a week after the showcase. And it's in all sorts of different pieces but then the January intake, I don't know what's going on with that, but Dennis Gennard, whose name's up there, he's the guy who knows what's going on with all the interns. It's better depending on what kind of skill set you need, it's better to get in earlier.
Okay.
This current group these guys are just finishing their internships. We've got a new group of students who have just started. Very different, again, same skill sets, but lots of programmers in this group, lots of designers, lots of filmmakers. No, you can for internships specifically, you can get them to start it, and then you can hire them part-time, or you can keep it going. Normally, what I recommend is you come up with sort of what the deliverable of the internship would be, and then it could be a project that you do with us. That's what a couple of projects have been. They've hired an intern that defined what a project would look like. They're very useful. They're really, really useful to put together money grants or to put together asks, because it's really hard to articulate an idea without showing a prototype. And so that's what I say. You're not going to have a finished product, but you'll have a prototype that you can then say to someone, so give me another $10,000 and I can finish it.
We're just about out of time. I think we have time for one more question.
Sorry to end it with a question about cost, but interns. So what is the typical range for hiring an intern? Does it matter on the I guess the level of experience?
I don't know if you guys are familiar with MyTax. We use the MyTax. What we recommend is $2,500 a month is about a normal range. Some internships, which we don't recommend ever, some internships don't pay at all. None of the advertising companies pay interns for some reason. And then the really high-end programmer interns go for more because they're just in demand. But they're anyway from $1,500 a month to $2,500 to $3,000 a month. It depends on what you want to do. But there's also a program which you may be eligible for, called MyTax, which matches dollars for internships. And that's where we actually work with MyTax a lot to try to accelerate how much people can spend on interns. And also, if instead of a 4-month internship, they can get an 8-month internship out of it.
And this is also, there's also a stream where you don't have to hire an intern, but it can become a project. Yeah. And that is a free, we just have to convince you of the value.
Yeah, and you have to, and all direct costs, you'd have to pay for all direct costs or whatever that would land up being. So we would talk to you about what that would be ahead of time.
Okay.
And it depends on what the project would be and stuff. But those projects are, just from an experience, and they're much harder for success unless you can dedicate some time to it.
Okay, so we're just about at the end of time. If there are more questions, please tweet us, and we will do our best to get them answered for you. Thank you, everyone, for coming and talking to us. That was great.
Thank you for having us.
The Evening Rounds Volume 12 is scheduled and ready to go. It will be on November 19th in this room, same bat time, same bat channel. We're talking about crowdsourcing health improvement. So I think that's going to be super fun, you guys. I think everybody should come. It features Providence Healthcare, our very kind sponsors, and their new digital hub. Please check it out at bloom.providencehealthcare.org. And we will see you next month. Thanks, everyone. Thank you so much.